But I never felt of doing work, sir. I
Okay.
thought of always having my own business, and I'm a basically entrepreneur, sir. In between, I do business on my own, sir. I
Okay.
had opened some few health companies also.
Okay.
Meanwhile, we for to in between before Corona had one company which formulations of drugs we did,
Okay.
sir.
Welcome, friends. Welcome to the yet another episode of Hall of Fame interviews. Today we have with us Dr. Kishore Reddy. He's a pediatrician, neonatologist, and an intensive care specialist. And he has opened 3 hospitals, in fact, right? So
Yes,
he did his MD and graduation and post-graduation from Andhra Pradesh and Belgaum. And since he came into field, he's directly started an entrepreneurship. Did not work anywhere, did not do job under anybody. He has been an entrepreneur at the core. So, welcome, Dr. Kishore. It's a
Thank
delight
you,
to talk to you.
Thank you very much, sir.
So, you never went to any job or anything.
No,
So,
sir.
was that you felt confident enough that you can run on your own? How and why not do a job?
No, sir. I did my PG from the SIM Institute, which is a
Okay.
named university. So I got enough experience. So the moment I came out of the institute, I have good experience with my senior. There in the college, I used to go for this OP also during my PG days. So immediately I started my OP. The day one, my OP was around 120, sir.
Okay,
I
120.
practiced like that for more of 3 years. Only means the where I practice, no sir, we can't do much more than that. OP, a little bit of few stick cases we can keep, not more than that. But I have been trained in pediatric ICU and neonatologist, sir. So I had a good opportunity in the other place. So I just by running my own hospital, by keeping other doctor in my place, I shifted to this new place and joined with one of my partner who is struggling to run his hospital.
Right.
So for a past till Corona, we continued the same hospital and we made it multi-specialty by getting all the government schemes, sir. Later onwards, I thought of starting my own setup. So again, one more branch started 6 months back from on October 2nd, sir. I'm have a planning of extending it to 200 beds, sir. Present my running own hospital is 25 bedded. This
Okay.
branch also.
So when you finished your MD, you
Yes,
must be getting job offers from corporates and other big hospitals also.
but I never felt of doing work, sir. I
Okay.
thought of always having my own business, and I'm a basically entrepreneur, sir. In between, I do business on my own, sir. I
Okay.
had opened some few health companies also.
Okay.
Meanwhile, we for to in between before Corona had one company which formulations of drugs we
Okay.
did, sir.
So tell me about your journey from the small setup in your own hometown, then to coming on to the Kadapa and then growing. How was the journey?
It was quite good, sir. But there, where in my hometown, I used to get a lot of money
Right.
with less risk. We
Your
here,
hometown doesn't have multiple hospitals, small village.
No. It is a model headquarters, sir. I used to get a lot of money,
Okay.
patients also, but I don't
Okay.
have professional satisfaction. I'm not.
High-end work you cannot do, right?
Yes, sir. I can't do much more there with my
Right.
caliber.
Right.
So I shifted to Kadapa. We did a lot of difference when we came to Kadapa and established neonatology setup. And first time we got in the entire district, we got the Arogyashi permission for pediatric department. Those days, we are the first to get the scheme, government schemes also. We served many people.
So what do you say about the government schemes? Because so many people are telling that it is not, money doesn't come and things are very delayed.
It was good, sir. Payments will come, sir. Nowadays, competition was more, no. And these rules and regulations was changed. Lot of permissions and all. mandatory documents and all more, sir. And the cases also getting split among the fraternity, no, sir. Most of them are taking government schemes, so it is diluted right now.
Still, you will say that if somebody is starting a new hospital, he should take schemes.
I prefer, sir, the insurances are good, but schemes depend, sir. If he is capable enough of sustaining for some days, if he is capable of sustaining with the competition, tell them not to go with the government schemes, go with the insurances, have some good NABH guideline hospital, so that you can get a little bit more patients and more money in terms of packages also.
Right.
Government schemes are to thrive, sir. If you
for your basic government means if you don't have beds full, then you take the government scheme. That is
yes, sir. Yes, sir. Yes,
and
sir.
If you have enough patients without the scheme, then go for without scheme.
Yes, sir. And in places like Andhra, it is they are making rules and regulations are very strict, sir, because they are making few beds has to reserve for the government schemes.
Right.
All that supervision and all little bit problem for the administrators. So
when you started another hospital in the Kadapa,
sir,
what was your learnings from the first hospital, and then you started second?
That time also, sir, staff problem was there initially.
How did you tackle that?
Supporting staff problem was there, and we need to counsel the patients in terms of risk factor also. They should be trusting us now, sir. Those things was there. Over a period, it is overcome by the gynecologists and other people who are referring also. They used to trust us. Depends upon our success rate. And later it went on well.
So how did you tackle the problem of how did you ensure that you have adequate staff?
That was to get non-trained staff, but we trained them in a good manner, so that we are overcoming the problem. Still, the problem persists for ICU setups. Everywhere the problem was there.
But still, you will focus more on the training and developing the good atmosphere, right?
Yes, sir.
You told me that you have other avenues or other companies also eventually entrepreneur, you have a business.
Yes, sir. Accumulation business, sir.
Right.
But nowadays,
start that?
Kept in silent, sir. Before Corona, I stopped it because now the work pressure was more in my hospital. I am not able to run two things at a time, sir, because now my partner is not able to manage the hospital, what we thought before. One will manage that and one will manage this, but it is not possible that time. So we went on. We closed.
Partner is also a pediatrician.
Yeah, pediatrician.
So tell me about some guidance to the people about partnership. How should you start a partnership, and what things you should take in mind?
Yes, sir. Actually, with my experience and my pitfalls, I can suggest them. First of all, be clear with the document. Right. Whoever, how close you are with the partner, or how much you trust him. With the words, don't go with the words. Right. Go with the paper. Okay. Yeah. That I learned from my personal experience. Yeah. When don't keep money of your share within the hospital for a long time. Means don't by not taking it your share and let the hospital grow. You should not wait for that. Whenever your share is about to take, you should take, and not the people not get greedy about the income, sir. On paper, you are not the owner, or you legally, if you don't have rights, means you should be very clear that your money get shared immediately.
Basically, you are telling that one is the paperwork should be perfect.
Regulations and the work also should be defined clearly.
There should be clarity at the beginning.
Yeah.
And especially clarity when you are dealing with the friends or family.
Yes.
Yes, that's a very important lesson. You also keep telling that no matter how good a friend or how good a close relative is there, when you are doing business, then it has to be done like a business only.
Yes, sir.
Tell me about this ICU, the setup that you have started. So what are the things which came across, and what are the challenges you faced starting an ICU?
No. Setup we started smoothly, sir. We used to take counsel the patient in a right way, and in selecting cases also, that is one more important point, sir. Choice of selection of patients. You should wisely select the patients, and to whom you are selecting the patient. The patient should understand what you are treating. How I follow that, sir? I follow one thing in NICU. It's all ICUs. Just explain the condition of the patient in detail. Let the patient decide himself to stay or not to stay. Regarding financials, regarding the risk factors, regarding the duration of stay, never promise him within 2 days, 3 days, like that. And counseling is matter, sir. Counseling is matter. And patient relatives have rights to know the condition of the patient. I clearly explain them morning and evening regarding the prognosis, everything, sir. Let them decide they want to continue treatment or take to some other center also, let them decide. My funda is give nice care, tell them the condition regularly, condition of the patient, and ask him to choose every time give option to him. And regarding financial also, we have to clearly explain them.
So there should be a good communication between the patient relatives and yourself.
Yes, sir.
They should be involved in the decision making of the patient. They're equally having the right whether to take a treatment, not to take a treatment, or whatever.
In recent times, previous first hospital where I told no, sir, that time we used to have some problems regarding this.
Right.
No proper counseling means my doctors. We have some other doctors also. Means for duty, they used to take care of ICU. I am busy with administration and all. I used to talk only with the sick patients and all. That time it will be very tricky. Now in my own setup, whether I do rounds or not, I just clearly know about my patient condition admissions. I just call them morning and evening. I will speak with them for a minimum of half an hour. I'll tell in detail about the case.
So you should be continuously communicating.
That matters a lot, sir. That matters a lot. Even some people who are hesitant to pay also, if we give such a care, we are transparent enough to tell them the condition of the patient. Most of them are paying the money also.
So two things are important. That one, you are a senior-most person, still you should be the person talking. And
yeah, that's what. The whole times rounds they do also. We don't do rounds also, they won't mind. We should know everything about the case. By sitting in our room, we should communicate them in a proper way what is going on.
It's a very important take-home message for a newbie. You have to talk to people.
During payment also, they won't hesitate, sir. Most of them won't hesitate if you have a good rapport with the patient.
Right. And you have right now 3 hospitals running under your belt, right?
Yeah, sir. 2 are my own and 1 is under partnership, which is I'm about to quit from that.
Okay. So 1 is in your hometown.
Yes, sir.
So what are the difficulties or what are the challenges which are there in Tier 2 or Tier 3 cities when you're opening a new hospital?
Availability of staff only major issues, sir.
Right.
Train staff, that especially. Even if you pay more also, what we face regularly is we train some good persons. Later on, the other hospital people these people are greedy, so that they will go for a little bit hike. And they will suddenly stop coming. Those things are everywhere, but in small towns like our place, no, sir, though means if you train well, one person means people may be really eager to take from our place where they have good exposure. They can charge a little bit more, 2,000 extra, because they don't have all the efforts. No, we will train them by paying all the days, whichever they don't do work also. For the previous month, those things will be there, but I'll always keep standby some of the staff extra. Somehow I am managing with
so things. That the clinical services are not affected.
Yes. Okay. That unnecessary 1 lakh to 1.5 lakh expenses we have to bear because to sleep properly in the night.
Yeah.
During the shift time only we will get all the issues also. Whether the patient that night the night duty staff will come or not. Those tensions will be there every time. If we have 1 or 2 people extra, we can make them stand by or make them do extra duties. Then it won't be a problem much.
So
I always suggest people to have a little bit standby staff.
Extra standby backup staff.
At least ICU staff at least 2 to 3 members. Anyway, by those people we can earn from them.
Right. Okay. How many doctors do you have in your setup under you?
Right now, I am having 3 full-time doctors, sir, and all the visiting doctors. I have OT also, gynec department also, and lab surgery, and other consultants will come and do the surgeries, and they will go, sir.
So, how did you get all these doctors together?
Most of them are experience, and I am by my goodwill, sir, and a few of them they are my friends, colleagues, sir. those who studied with me. And most important thing is I pay them immediately without delay. I don't
Good
cheat
payment.
I don't cheat my fellow doctor by giving less. I thought if they are happy, my institute will grow.
Who looks after your administration? How many staff you have in administration?
I have put around 5 staff in the day and 2 staff in the night, sir, for admin. And I myself look into each and everything, sir.
So your practice, your ICU, your admin work, how do you divide time?
Most of the time I'll sit in the hospital.
Right.
And in between sudden I will do rounds in the midnights also.
So you keep a good check.
I'll keep a good check, sir. And I'm a little bit harsh in administration.
You have to be, actually, you have to be compassionate towards good people.
I treat them like my family. I'm a little bit strict in
okay, pediatrics, sometimes there is a problem of patient getting not satisfied or getting a chaos in some patient if it is not doing well.
Sir,
so how do you handle that problem?
80% of the problems will be solved if you have good counseling with the patient from the beginning.
Right.
80%, 20 within 20, those 20%, among the 20%, 10%, we should be very intelligent in referring the patient.
Right.
If you are not able to, or if you are not good in mood to treat, or if you are not having the consultant on that day, just refer the case.
Timely referral.
Timely referral. 10% you should be always ready for things, and you should have some contacts on the rapport with the politicians and all that. Such things also to be maintained.
This is also very important, right?
Yeah, local, whichever place, your hospital, under whichever station, you should look after. And the person who is coming in charge of that station, you should have his number. And if you have good rapport, be friendly with him, then everything can be done.
All this networking pays you in the long run.
Yeah, you should have a PR also, public networking with whoever required to you. If any issue comes now, first will be station, next will be politician.
So basically, we also tell this thing to the other doctors that you should have networking with non-medical also.
Yeah, all non-medical people. Medical people who may come or may not come. If something happens, our team of non-medical friends we should have always backup.
Right.
So within a call, you should have some mob.
So if there is a new pass out from pediatrician, MD pediatrics, so what will you guide him? Whether he should join a job or start a own clinic or practice or hospital?
First thing I tell him, just go and have a look in that place where you are going to settle, and plan yourself how you are going to settle. Whether you want to go with the own setup or with means already if it is loaded with number of people. If you are how you are going to settle, means if he is a pediatrician, whether you want to go with only OP or my minimum admissions, or you want to go with higher end setup. If you want to go with the higher end setup, you should be back up. You should be get enough funds, all the equipment and all. You should also ready to invest all those things also. You should be prepared for the investments.
So best way is to start a stepwise. Just some small setup and then slowly.
Money and always better under some roof. You admit your cases. That person will take care of things. I suggest that most of my juniors also they admit under me here. Even the qualification also more. They are from PGA everywhere also. They will come and do rounds under me, and they will admit cases under me because I deal with other things, sir.
You're strong in the other things also.
That is important, more important. They even if for PG Chandigarh or IMS specialized PG, he won't get one supporting staff for cannula. He himself has to prick the cannula in the middle of night. Such things will be there. So in places like small places, those are all matters. You won't get qualified staff. Treating is not important. The patient who the aftercare is very important.
So, what is your opinion about the academy, Doctorpreneur Academy? What do you say?
I gone through it, sir. I just few glimpse of your videos and all. Not in depth into or this thing, sir.
But you think that it is a good initiative?
Yeah, I'll always encourage those people who encourage others. Even I encourage those. I give opportunity to most of the learners after UG, after PG. Some of the pharma courses people, they will come to work for me. They want to learn. I encourage such people. I want to make them learn few things from us. It will be helpful. These are all professional courses, no sir. Wherever they learn, they will remember for lifetime. I always tell them to learn. I give opportunity for them.
Great. What is your future plan?
I want to set up one 100-bed hospital shortly. About to start construction in my own site.
Okay. So if you have any requirement, just get in touch with us, and we'll also help you out if you want.
Sure.
Great talking to you.
Thank you very much.